think. Just one last question that before we conclude the episode. Is that what things would you like to see, either in terms of a grassroots or legislative side of things, in the future to address some of the challenges that community practice is facing? Because I know you are working a lot in terms of like trying to make changes surrounding community practice, and see, is there any particular thing that you have in mind that really shines you out and say like this is what the future is about?
Um, I'll say for me, it's around provider status for pharmacists. So that's probably the big like pie in the sky thing that I would like to see change. Um, in California, we have provider status, and so for patients that are low income, that are getting help from Medicaid, um, or in California, it's called Medi-Cal, right? We are recognized as providers, and so for those specific patients, we can potentially bill for our services. Now, even that process, I think, needs a lot of improvement because it's a very confusing process to get paid for those services, and it's not as easy to just say, oh, like I can send a bill to the insurance company and I'll get paid. Just depending where you are in California, you may not get paid, even though potentially it's set up for us that we can. If we're talking on a national level for patients that have like Medicare, which is federally funded insurance, for those um, payers, we aren't recognized as providers, and so because of that, the clinical services that we provide, we can't bill for them, or the organization we work for can't bill for them, and so it limits a lot of what we're able to do because we could spend the time doing it, but if there's no payment or reimbursement in that, then that service doesn't become sustainable. Um, I think that there's a lot of other things going on advocacy wise, like even right now, I guess expanding some of the services that technicians are able to do, right? So right now, like they were able to provide COVID vaccinations, but it's only specific to that and only during this like emergency time period. So once that ends, then um, technicians aren't going to be able to legally provide vaccinations. And so if we can make that more long term, I think then pharmacists will be able to not only continue to help with vaccinations themselves, but to be able to focus on other services as well. Um, I'll say one other thing is as we expand the scope of what pharmacists are able to do, we're able to do more and more. But um, you know, we also need to balance that out with not putting too much on our pharmacists. I think there's a lot that's expected out of and I'll speak from a community standpoint, from our community pharmacists in terms of checking prescriptions, checking drug interactions, counseling patients, answering questions on the phone, managing the staff, vaccinating patients. There's a lot of responsibilities involved. And so I think we need to be able to, distribute those responsibilities in the community pharmacy setting so that we don't burn out our pharmacists.